Then comes Chikitsa Purusha. It's a sutra, what we can say. For Purusha, what we are going to do. Chikitsa Purusha means a person whom we are supposed to treat. Chikitsa Sutras are nothing but what all the regimens we have to follow to treat him, to keep him healthy, to keep him alive in a good state of physical, mental and spiritual level. So Chikitsa Sutra principles of treatment, what we call Antar Parimarjana, internal medications. Whatever we give internally, like whether it be a kashayas or churunas or lehyas or matra pramana, whatever we take internally through the mouth origin, we can take as an internal medication. Still, in enemas wise, medicated enemas, when a person is not able to take through the mouth, we do give administered through anal region. That also can be taken as an internal medications, or our injections, whatever presently we are doing it, that also comes under internal medications. That means anything goes inside our body through the orifices, mouth or anal aspects, we can say. Bahir Parimarjana is a topical application. That is nothing but external application like an ointment, any oil or any lepas, what we call. This is Bahir Parimarjana, where we use majorly in Varmam, using our Varmam massaging oils or Varmam points to relieve or activate adangals. Shodhana karma is a purification or detoxification. Shodhana is completely, you have to clear from the root of the problems. That is known as Shodhana. Shamana is pacifying, suppressing or clearing, or just it is a simple process wise that if it is affected because of the season or because of the sudden onset of a problems, where we can use Shamana Aushadhis, that is pacifying, where the disease will be cleared here also. Only in a chronic cases where it has gone to Dhatugata, means it is deep seated, there we do go ahead with Shodhana karmas. Brahmana, after clearing, after an emaciated people, we have done all the cleansing, like Shodhana or Shamana, we do administer Brahmana karma, enhancing. If it is a Kshaya person or a weak person, emaciated person, we have to give him strengthening part of dravyas known as Brahmana dravyas. Langana, it's nothing but reducing. Langanam paramaushadam, we say in fever diseases. Like fever may be one of the cause for ama, that is undigested material or thrown out, not completely thrown out conditions wise. There we ask them to do upavasa, that is langana, where it can be cleared or completely removed of the system, or even in obese, that is medha dhatu, which is increased. There we do provide treatment of langana. Sharirika, somatic, for body concerns wise, generalized, whatever we have to do, that will be manasika, psychiatric. Majorly, we can see for anyone, counseling is very much important. Present science, we say, psychiatrist is developed, but we can see in our Ayurveda, Manasika Chikitsa also has given main importance to treat a person, to build his life. As we are dealing with majorly Varmam aspects, I feel Bahir Parimarjana Chikitsa, if I given more importance to understand, it will be good. So I'll be giving you the definition of what is Bahir Parimarjana, wider spectrum of applicability, type of the result, emphasis on Abhinga, what all type of Abhinga can be given, which part of the body Abhinga can be given, and Svedana, that is sweating line of therapy, how the doshas can be expelled out from our skin porous. This also can be done. Udvartana, reverse way of massaging for adipose tissues, or if there is any accumulation of Vata covered with Kapha doshas, hardening of the part also can be used with Udvartana. Stanika Basti, particular part like knee, if there is a knee pain or something, Janu, what we call for a knee, Janu Basti we can do and heal the knee problem like osteoarthritis. Even Kati Basti, what we say, for a lumbar area. We do provide one well like a substance with our floors. We make it like a well substance and pour into a lukewarm oil, medicated oil, which this oil penetrates deep into the structure, enhances the strength of the nervous system, relaxes the stiffness of the muscle, removes of the blocked doshas and heal the particular area, and person can start becoming normalized. Same way we do use in neck, Griva Basti, Shiro Basti. As I was just mentioning, Manasika Rogas, here we do use Shiro Basti. Even in paralysis, it works to stimulate the entire brain nervous system, where Kapha dosha which is accumulated can be cleared, or Vata dosha can be cleared, where the person thinking capacity increases, the blockages will be removed, so our pituitary or pineal gland can activate in a better way. As we have cranial nerves, they all get activated and nervous system completely becomes better. Being Panchakarma. Pancha is five, as we know. Karma is actions or kartavyas, what we do into. This is Shodhana Karma, we can say. In Panchakarma, before Panchakarma, there is a Purva Karma. Pradhana Karma is the Panchakarma, what the exact therapy is what we do. Paschatya Karma is after Pradhana Karma. What are the karmas or the actions to be taken? It is being divided into these three headings. Purva Karma we call as a Snehana and Svedana with Amapachana. Undigested material has to be cleared first. Otherwise, that itself is a visha to our body, which is the main causative factor for our diseases. So that has to be cleared. Pachana has to be done, Deepana, then fire has to be increased in the system before doing any of these therapies. Then comes our Snehana, oil way or ghee. Internally we do give Snehana Karma, where whole body gets overoiled, and with the medicated oil or ghee, the doshas accumulated inside the body, inside the cells or inside the srodasas starts getting liquefying, or if it is hard, it liquefies, or if it has to be brought out, this Sneha Dravyas mingles with these doshas and brings the doshas outside the body. With the Svedana, that is a sweating life therapy, what we do in, there are Bashpa Sveda, Nadi Sveda, varieties of Svedana Karma are done. The skin pores will help the doshas to come out from the system, or if at all the doshas have been completely hidden inside the body deep structures, that gets liquefied and starts pouring outside in Svedana Karma. These are Purva Karmas what we do in. Once this treatment has been taken care, we come back to Pradhana Karma. There is 5 detoxifying procedures: Vamana, Virechana, Basti, Nasya and Rakta Mokshana. Vamana is any doshas above the umbilicus. Kapha dosha, what we can say majorly blocked in, like in asthma, kasa or shwasa, what we call into, or any skin diseases, kushta, what we call as. These doshas can be brought out by Vamana through the mouth. We do provide them lot of medicated kashayas and bring the doshas outside through the mouth. Vamana. Virechana is through the rectal area. The medications will be given through the mouth, and Virechana, loose motion, will take care with removing all the doshas from our body. Then comes Basti. There are varieties of Basti what we do, Niruha and Matra Basti, Sneha Basti what we call into it. This exactly strengthens up the nervous system. When a person is not able to take anything orally, or body system is very difficult, we can administer the medications like Matra Basti through the anal area, where it absorbs faster than the mouth. There are varieties of Bastis, like paralytic patients we do give, or a nervous system we give. Uttara Basti is now presently we are practicing quite a lot also, like in infertility cases, to strengthen up the fallopian tubes, uterus and inner seminal vesicles. to enhance sperm count. This is Uttarabasti we do. And Mutra, Ashmaris, if there is stones formation or kidney activation is not up to the normal, if they are very weak, we do administer Basti. Examples what I am mentioning here, that's all. Nasya, this is being done through the nasal area, where in like migraine, what we say, we can be cleared, or sinuses can be helped into, headaches, all nasal above the neck part can be covered beautifully in Nasya. Allergic rhinitis, this can be made into normalized with Nasya therapy. Ratta Mokshana we do with two gadgets like, one is not a gadget, it's a Jaluka, it's a very healthier and animal what we can call into. It sucks all the vitiated blood from our system, helps a human being to remove the doshas. It's a beautiful process what we can see in any pain management can be done, any visha management can be done, any pus formation is there, this can be left there, Jaluka, then can clear up the doshas from there. It beautifully takes out all the toxins from our system, and we can remove the toxic blood outside and keep the Jalukas in healthy way. To keep a person healthy, Jalukas helps in as Rakta Mokshana. One more is bloodletting, what we call. We do use small needles with bloodletting therapies. Excessive dosha accumulation can be helped beautifully with the Mokshana, Rakta Mokshana karmas. Paschata karma is after all this cleansing system. Sometimes a patient becomes weaker, or all the cells accumulated with doshas or doshas, what we call, affected ones. Cell requires something good, energy or a good nutrition or a good food to maintain health. That aspect will be taken in Paschata karma, like Vajikarana dravyas. If a person is to want to be young and energetic, we do the Vajikara dravyas, like to enhance his sexual desires in infertility or motility for a person, in a man to increase sperm counts and to enhance his sexual activities. In a female to regenerate the ovums and work into basis. In arthritis cases like osteoarthritis or a person with a paralysis aspects, we do help them to give a nervous strength, muscular strength, skeletal strength, all those doshas to be cleared and helped into in Paschata karma. This process has to be done with an expert Ayurvedic people, because as what I'm explaining is just a simple few words, but they can help you. If not done properly, they can kill us, means the administer, means the doctors who are doing or a therapist who are doing, because patient condition cannot be revived or revised into normalcy. So we have to be very careful when we are doing Panchakarma, but the results, if it is done, you can say you can rejuvenate a person.